Hi, everyone. Welcome to the Geriatric House Call Dentistry Group's discussion on extractions. We're going to talk to you all about extractions today. Three experts. We all go into people's homes. We love it. We enjoy it. But a lot of people call us and ask us about extractions and how the heck you could do them at home. So we're going to have a little roundtable, and we have some questions that have been sent in and prepared. So I'm going to start with the number one question that everyone calls us about. And it goes like this. Hi, my mom's crown fell out and I'd like you to re-cement it. Can you come to the house and re-cement it? So we're going to go around and I'm going to start with Joy. Joy, what do you do when you get that question?
So the first thing that I do is I ask to see a picture of the crown. And the reason why I want to see a picture of it is because I want to make sure that it's just the crown that came off. There's always a possibility that unfortunately maybe part of the tooth had come off because of either dental decay or because the tooth had fractured from eating something maybe chewy or too hard. And so by seeing the inside of the crown, I am then able to determine whether or not this is just a re-cement. Fingers crossed it is, or unfortunately it may need to be a tooth that has to actually come out.
Right. So we'll go from there. So if we get the picture and we see that the tooth is actually in the crown, and that when they take a picture of the mouth, you see that there's nothing there to re-cement, we then tell them on the phone so that we don't have to disappoint them at the visit that we can't re-cement it. So we all do that as a courtesy. That's something that the three of us do. And if we have to tell them at that time the tooth needs to come out, it gives them time to let that settle. And we explain to them that the tooth must be extracted or not, right? Sometimes we just leave it alone and it depends on the age, if the tooth's been root canaled, if they're in pain or not. So that is what we do with pictures. And this actually comes from the patient with the wife has the finger in the mouth. That's not our finger. And this is actually Dr. Klein's patient. So Dr. Klein, why don't you discuss exactly what happened with this patient?
So what happened there was that the entire bridge was hanging just from the one tooth that was all the way on the right side of the mouth. So we got the consent and we pulled the tooth, and then there were a few root tips. I don't know if you can see, but there were a few that remained, and the ones that we were able to go in there and get, we did. She was a little frail and wasn't really interested in having them all removed, so we just did a few of them. And then you see right there, I don't know if I can point right where the fingertip is, there was a bit of a tooth with gutta percha, so there was a root canal there. So we definitely took that one out. And we then let it heal up a little bit. And then I made her a partial upper denture, and it connected on the tooth that you see back on the upper left there that remains. And she was very happy.
Okay, so here we have a loose bridge and the family wanted to know if we could re-cement it. Again, this is Dr. Klein's patient, and she was able to go in there, extract those teeth, take the patient out of pain. He never felt it. She gave a special injection that we'll discuss in a minute, and also was able to make a partial denture. So that was great. Okay, let's go on to another question. The next question is about dementia. And we deal a lot with dementia, Alzheimer's disease, Parkinson's disease, ALS, and that's why it's so important to find a dentist that can come to your home. So the next question is, how do we deal with the dementia patient?
When it comes to dementia, I want to find out if the patient is on medications for dementia. I want to know if the patient, who the caregivers are, because ultimately speaking, I'm going to be communicating about treatment and diagnosis with the caregiver. I want to make sure I know who the power of attorney is, both medical and financial. And once I'm there, I want to know who's going to be there with the patient, so that not only am I communicating with the patient, but more importantly, I'm also communicating with the loved one who's going to be helping me diagnose and treatment plan for this patient. That's number one. first
How
and
about
foremost.
extractions? When it comes to the extraction part,
Sure.
how do you deal with the dementia patient?
So when it comes to the dementia patient for extractions, I want to make sure I'm isolating just that one particular tooth. I don't want to do a whole block when it comes to making the patient numb. There's a really good chance the patient is going to be unaware that they're numb. They might start biting their lower lip. There could be a lot of complications involved. So we can provide, like you were mentioning before, a special injection where we just go around that one particular tooth so that that one tooth alone will be extracted. It is incredibly, it's much easier to be able to do it that way. The patient is more comfortable, and all around there's less trauma involved.
Right. And then also I'd like to add that we put in a medicine that coagulates the blood. So we never leave a patient
Oh, no.
bleeding. We never. If we have to be late for the next patient, so that's why we're late sometimes, we make sure that patient is comfortable before we leave their home. Okay, I have another question for Rachel. Rachel, do you treat people in the bed, in the chair, in the wheelchair? Why is our practice so unique when we do extractions? Are you able to do it in those places I just mentioned?
It's pretty incredible to think that we can, but we can. We do it anywhere. In fact, if you gave me a swing and told me to hang upside down, I think I could do that too. We just want the patient to feel comfortable as much as they would be in a dental office, or even more so, because they can't get up, they can't get out. And so we're here to help you get the job done in the most comfortable setting possible.
Let's talk about getting numb again. I'm going to start that over because he's going to cut. Let's talk about getting numb, getting the patient numb. I think one of the things that I'm always very careful about is making sure that you don't get them numb in many places in their mouth. So how do we get them numb so that we're just able to address the, trash that. It's very difficult sometimes to work in people's homes because the lighting isn't so great. What do we do about poor lighting? I mean, we can show homes that literally we don't even know how they exist because it's so dim. How do you address the lighting in the home, Joy?
So when it comes to lighting, I ask first, where is the patient going to be when I see them? I want to know if there is going to be a way where we can open blinds, where we can have above lighting. Is there a bedside table light? If not, can we place one there? I also want to make sure that we use flashlights, quite honestly. I mean, you know, the Girl Scout way, you know, you use what you have in the moment. And so I will make sure that there is I always carry my own flashlight, as well as I make sure that the patient's loved ones will have a flashlight as well. I want them to be engaged. I want the caregivers to be engaged. I want them to see what we're doing for our patients. So they're behind me with a flashlight so that I can see more clearly in the mouth, so they can see what I can see and what the problem is.
Rachel, how do you address the lighting in the home?
Well, I used to do what Joy did with the flashlight, but I recently invested in a wonderful, wonderful pair of glasses that have a loop and a flashlight, because you know what? I couldn't always rely on people holding the light in the right place, because sometimes there are situations where it is literally like being in a cave. And I just didn't want to have to rely on other people so much. I just wanted to come in with my own light, and it's really changed my life incredibly. So that's what I do.
I want to switch to another topic when it comes to extractions, and that is blood thinners. And I would like to start the conversation with something that happened to me about 2 weeks ago, and that is that the patient was on Eliquis, desperately needed some teeth extracted, and the doctor said that I had to extract the teeth on the Eliquis. And I had to do it. I had no choice. I had to do it. I knew the family, luckily, and they trusted me, and I was able to do it. and I was able to get the patient to clot. Most of the time that does happen. It's very rare that they don't. There's lots of reasons for that. But I was able to put in a foam, which made them clot. But let's go around the table and talk about patients are terrified to let you come into the home and do an extraction because of the blood thinners. Joy, how do you handle that?
In Illinois, I'm required to have a written medical clearance from the physician stating that the patient's medically competent to have the tooth extracted, as well as I also make sure that the right hand knows what the left hand is doing. Incredibly important. The medical doctor needs to know what I'm doing, and I need to know what they're doing and what they consider more important, whether or not the patient needs to be on a blood thinner like Eliquis or not. Once we have that established, if they decide that the patient is going to be on it, then we try to make or schedule the appointment as far in between the dosages as possible. So if they're doing it morning and afternoon or morning and night, then it's in the middle of the day that I am providing that treatment for them. And then, of course, like you were saying before, I do not leave until the patient has stopped bleeding. That is critically important. To make sure that the patient is going to be in a good place for healing. And I also agree with you. There is a special foam that we can use that will also do a wonderful job in help maintaining the area, as well as to help promote good healing around the gums.
So everyone, this is an example of how we work. This woman could not get out of bed and she needed some treatment. We went in there with the light. You can see how bright the light is. The caregiver's in the background. There's actually a family member also in the room. And this is just par for the course for all of us. So I just wanted to show you what the lighted loop looks like. And just that we can see people in the bed, in the chair, in the wheelchair, if they're leaning against someone. It's just very important that their head is supported. You know, we all have good backs, I hope. And this is just an example of us treating a patient in their apartment or their home. Let's talk about something fun, okay? I think that one of the things we need to talk about when it comes to extractions, we're all going to tell a funny story, and I'll start with, I went into someone's home to extract a tooth. I knew I could do it. If I can't do it, I send it out. Let's just put that out there. When we get in there and we see that this is something we shouldn't touch, we say, I'm sorry, we have to send this patient out. So that's very important for everyone to know. We don't do it unless we know or 100% sure that we can get a tooth out. If there's going to be anything that's precarious or unknown, we stop, we don't charge, we send out. But I was in a home the other day and I took out a tooth from a very famous rock and roll person, can't tell you who, and his wife was sitting by, and I took the tooth out, and I always like trick them a little. I'm like, all right, I'm gonna do it now, and it's done, right? I'm done. And there she was, fainting. So I had to stop what I was doing, he was fine, and I had to put her in the bed and take care of her. So I always ask the person who's helping me, are you afraid to watch this? Because if you are, I have to take care of the patient. I can't take care of you. So do any of you have any funny stories like that you want to share?
I don't know if this would be funny or not. The 101-year-old I was telling you about, the daughter, after I was done, I was talking, about post-op instructions, right? What to do, what not to do. She was at the patient's in bed. She was at her feet. She goes around behind me. Now, at this point, I have isolated the tooth. I have my little table that I have set up for this treatment. She goes over and she starts playing with my instruments. This woman is herself probably in her 70s. She starts picking up my instruments. I can see her from the corner of my eye, looking at my instruments, picking up my syringe, picks up the tooth, is looking at the tooth, trying to figure out, and mind you, they're Spanish speaking. So she does not speak, of the three of them there, she's the only one who doesn't speak English. So I can't really communicate with her and saying, please don't touch my stuff. So I don't know if that's funny or if you want to, include that or not. But yeah, the idea was she was incredibly curious about the instruments that I use, what I did to help her mother. Obviously her mother was perfectly fine. she was curiosity killed the cat, I guess. She just was, wanting to see the, what I did.
Speaking of cats, I don't know if I mentioned this to you in our last interview, but for me, my craziest extraction story was when I was pulling out a few teeth on a patient, and all of a sudden, 2 cats jumped up on the patient's bed. And I promise this is true, but I had to pretend like everything was cool and this is a totally normal thing. So I just, I mean, luckily I was wearing a mask because I am allergic to cats, but I just kept on doing what I was doing, and I actually pet the cat, and then I continued what I had to do and just said, "Oh, well, what's the cat's name?" And that was that.
That's all you can do. Oh my gosh, that has happened to me too. I actually got scratched by a cat in the middle of an extraction.
Ooh.
The cat came running in because a child had come in or something, and the cat just ran right past me, obviously was scared what I was doing to, its owner, and scratched my leg as I'm taking a tooth out. And I just had to play it along like, oh, no big deal, all in the day, all normal. Oh my gosh, I'll never forget that as long as I live. Thank you for bringing that up.
Yeah, you did, because you said the word cat.
Curiosity killed the cat.
Right.
Oh my gosh, not the first time, I'm sure won't be the last.
I thought of something really interesting. We only have 2 minutes left unless we get cut off, but we can come back because I think that we maybe want to redo a couple things. But here is a very important thing for us to talk about. I'm going to introduce it. One of the things that I think really sets us apart from other house call dentists, and there aren't many, is how important infection control is when it comes to extractions. And I know that we all have such great work ethics. And one of the things that we all do is we come in with our sterilizable bags, and the instruments are absolutely sterilized. So it's very important when you choose your house call dentist that you ask them if they sterilize their instruments, how do they sterilize their instruments, and everything about infection control. Because even before COVID, I can tell you that we've all been very, very, very in tune with how important infection control is when you're going to someone's home. Joy, how do you deal with that?
Oh, that's such a great question. And I make sure I let them know that I have been COVID vaccinated and have been for a while now. That is incredibly important to let them know. And it's okay if they're not. I'm not here to judge. I am, so they can trust me on that. Number 2, I absolutely will show them my instruments to show them they are fully sealed and that they are sterilized. And sometimes if the patient is really nervous or the family is really nervous, I'll actually bring an unsterilized pouch to show the difference in what's sterilized and what's not. At that point, then I will put the instruments, I'll seal them in a sterilizable bag, which then I'll bring back to the office, open up, wash again, and then sterilize in my sterilized unit. So those are all ways that I show that and I also want to make sure that I isolate the area of where my instruments are going to be. So they might have cleaned off the top for me. I will bring my own wipes. I will wipe down, apply paper towels, and then put my instruments on top of it to make sure that I have an area that is isolated and well prepared for an extraction where we want to prevent any post-op infection of any kind.
I also love when patients can provide chucks, because that's even better.
Yes, I love chucks.
Me too.
Love, I ask for them. Chucks are big pieces of plastic with a big paper towel on top, in case people don't know what a chuck is. So any more questions that you guys can think about in terms of extractions? Like, think of one more if we have the time till we get cut off, because I think we got plenty of material to cut up. We talk about not cooperating, dementia, sitting up, the lighting. Okay.
We can also mention how, I know Joy did touch on this, but it's always so helpful to have a family member or someone who makes the dementia patient feel more comfortable, because we're a stranger.
Okay. We touched on the topic of the dementia patient and extractions, but we all know that the dementia patient or the Alzheimer patient is terrified. They don't know us. They don't know who we are, that we're their dentist, and we all have tricks of the trade to get the dementia patient or the Alzheimer patient to cooperate. So let's go around and talk about how we do it. I'll start off by always asking a family member if they can't be there. If I can say that I'm one of their friends or I'm their dentist, and I get some personal information, I say, I'm your daughter's friend from high school, and I'm doing this as a favor. She asked me to come over and to check you out. You have such a loose tooth. Let's take you out of pain. That'll be some of my tactics, kind of lying, fibbing, I don't know what you want to call it, but I get them to cooperate. Rachel, what do you do to get people to cooperate?
You know what? I just come at them very slowly, very carefully. I talk sweetly. I'm not acting. I'm just trying to make them feel comfortable. No sudden moves, no aggression, just calm. And I try to talk, just say, oh, and then today I did this, just to make them feel like we know each other. There's a familiarity between us. And this way they feel more comfortable. And then I start talking to the aide or the family member and show that we're friends and we're all going to get along and everything is calm and peaceful. And definitely tell them everything you're about to do, except for maybe say, okay, I'm coming at you with the syringe now. But I will say, okay, now we're going to get you numb a little bit. And that's just all we can do.
If you ask the caregiver to pinch the nose like this and hard, as you're giving the injection, it does two things. There's something about it that makes them not feel the injection, and it takes their mind off of it. So that's something that I always do. And
I'm a lip shaker. You too.
Yeah.
What do you?
So yeah, absolutely. So I always want to make sure that I try to be eye level with the patient. So if the patient's in a wheelchair, I will kneel to be eye level with them. I also want to be able to talk to them face to face. I don't want to be communicating behind them. That distracts them, that makes them nervous. They don't know who I am in the first place, and now I'm talking to them and they can't see me. So eye level and directly in front of them is crucial for me. I also will tend to speak slower. I will give them as much time as possible to ask me questions. And when it comes time for the actual extraction, I ask them, I say, help me help you. I know that you need help and I can provide that help. Help me help you in getting you out of pain. I can't tell you, they feel there is a change that comes over them because now they're actually participating in this by keeping their mouth open. They're helping me. And it usually makes a great appointment.
I have one more question. There are times that we know as dentists that the patient is in pain, the dementia patient. They cannot tell us, but we know they're in pain. We push on the area and you see them wince or they hold their face. And sometimes the family member is afraid to let us extract a very painful tooth. And there are times where I really have to talk them into it and tell them that's why they're not eating, or that's why their lifestyles change. They're moving around a lot. They can't focus. And a lot of it has to do with pain that they can't tell us that they're having. Have you guys experienced that same situation?
I personally haven't. I feel like the families are very trusting. I think that watching these videos that we have on our website really help the family see who we are, what we're about, and I think they trust us. And I also am very, very constantly in communication. I always am very accessible. I give people my number, text me any time of the day, I'm going to answer you back. So I think when people trust us, I think they know we're going to do right by the family.
Right. And do you guys always do a follow-up call after an extraction?
Always.
All the time.
Always. Yes.
Yes.
And sometimes even the next morning.
Yes. Yes. Or even days later if it was particularly stressful for them.
Yeah. I think that we're all really caring people, and that's why we're in this job together. I think it's really great that house call dentists exist and that the three of us pretty much have focused on the geriatric population because that's what we do best. And I think that there's a great need for this type of service. I mean, if you need an extraction and you are bedbound, what do? You suffer, or you go in an ambulance to the hospital. So the fact that the three of us are doing this and taking that chance that we know that we are capable of doing is so great. and we are really making a difference. And I'm so happy that I have two of my favorite people in this group, and we really help each other. And there are times that, you know, Rachel will call me and say, would you extract this tooth? And I say, Rachel, of course, you know, we have such empathy for these patients that we don't want to do anything that risks them having not a better quality of life, but a worse quality of life because we're extracting. So sometimes we leave root tips in. We say, leave it alone, right? So the quality of life is what we aim to achieve, a better quality of life and the best for our patients. And we don't do anything for monetary reasons or for anything but to make the patients' eating habits and their lifestyle better. So
True.
Thank you all for joining us today. And if you need someone in the Chicago area, Dr. Joy is the best. And Long Island and Queens, we have Dr. Rachel Klein. And I am in Manhattan, and I wish I could be in Brooklyn. So if there's anyone out there that knows someone who will come to Brooklyn, please give us a call. Thanks for joining us, and we look forward to our next series.